my name is Jennifer Knopsahota. I'm the program director of the MN-NP and the PMD program, so the NP programs. Today's session, as I said, we're going to walk you through curriculum updates to the NP program, talk to you about what is changing, what is not changing, and what it means for you as a current or potential incoming student. So I want to stress to you that this is not a new program. It is the same MN-NP and PMD program. It is an update of curriculum to align with the new competencies that are for all NP programs on the national scale. You will not be disadvantaged if you stay in the current curriculum, and we just want to provide you the options and give you more information about what is changing in the program. Before we get started, though, I'd like to firstly do a land acknowledgement. I live in Edmonton. I want to begin by acknowledging that Athabasca's main campus is located on Treaty 6 territory. This is traditional lands of the Cree, Dene, Blackfoot, Saulteaux, and Nakota Sioux peoples, and of the Métis Nation of Alberta. I want to take a moment to recognize that we likely have participants from across the country joining virtually today. Where I'm in Edmonton is also on Treaty 6 territory, and I invite you to share in the chat where you're joining from if you wish to acknowledge the Indigenous lands that you're situated on. Our plan for tonight is some basic introductions. We have a few faculty and some of our administrative team that are here tonight to answer your questions. We'll talk to you about the regulatory changes or the reasons why our curriculum is being updated. Key clinical practicum expectations, which are largely already enacted and we are following for our current curriculum that we are following. Debbie Fraser is going to talk to us about our updated curriculum, what it means for you as a student, what it means for you if you are a potential or a student who might be applying for admission or will be admitted for the April 1st intake. What is the transfer process if you wish to and are eligible for the new curriculum? And then we'll have plenty of time for questions at the end. You'll note that I am recording this session so we can make it available to all potential students and students. I want to firstly talk about why we are making these changes. If you have been in the NP landscape across the Canada for a while, you will note that around 2023, that there were major changes in NP licensure that were impending and are coming now. Essentially, starting in spring, summer are the first provinces will be making the changes. So all NP or all universities across Canada who offer nurse practitioner programs have to update their curriculum to account for and include coverage education on all of the entry-level competencies for nurse practitioners. This is a national set of competencies that are outlined, and CRNA in Alberta, College of Registered Nurses of Alberta, which our program is approved by, has acknowledged these competencies, and we are required, to make program updates to make sure that we are covering all of the competencies. You'll note that practice settings now, it will be single licensure, so no longer will there be primary care programs, acute care, adult-only programs. All nurse practitioners will write one exam, and it will prepare you across the life stage in a variety of settings. Now, we have already updated our clinical practicum side of our program to account for these, and we've expanded from a primary care program, which we initially were and have been for many years, to include and mandate different clinical practicums in all settings. Now, that is at a generalist or a basic type of level as we are preparing NPs to enter practice, not to become specialists. And that is the same for all NP programs with the exception of the neonatal program, which of course is a specialty type of program. We maintain the 5 roles of the nurse practitioner, which are broadly known as clinician, which is where we spend the majority of our time in the education program, is focusing on clinical type of topics, leadership, advocacy, educator, and scholar. So of course, everything we do is based and grounded in evidence. So our NPs must become, as RNs as well, you must be able to access and utilize the high level of evidence. There are expanded competencies that the CRNA and all of the regulators across Canada have endorsed, and these are what you might say initially look like undergraduate type of level of competencies. They are communications and counseling, policy, program implementation, things like quality improvement, patient safety, Indigenous health and cultural safety. Now, these are definitely topics that were introduced to you, as were most of the topics within the NP program. And really, we're building on these topics that you have already captured and covered as a registered nurse. So we go by introduction, reinforcement, and then ultimately mastery of all of the concepts within the program and scaffold on top of those. I'm going to turn it over to Dr. Lynn Miller, who is the clinical lead for the nurse practitioner program, to talk to you quickly about NP clinical practicum expectations.
Thanks, Jennifer, and thanks everyone for being here. I hope this is going to be helpful to you this evening. So the clinical practicum, as Jennifer mentioned, we previously focused on primary care. So community-based clinics and the type of settings where you would get more of the primary care level. The revised structure of the program for clinical purposes will look at exposures across all age groups, which is what we have been doing. However, there's going to be a focus on more diverse practice settings. We're going to have people minimum 2 clinical settings, ideally with at least 1 primary care setting and 1 acute care setting. Acute care can be quite a broad interpretation. It could be certain hospital units. If you're in a community with a combined clinic hospital setting, there's opportunities there as well. And that's part of the process that our clinical placement coordinators will be working with you to help arrange when you put in your applications for clinical. So we want at least 2 clinical settings over the course of your clinical program and a minimum of 2 preceptors. You're not limited to 2. The more preceptors you have, the broader is going to be your experience as a student and better prepare you for entry to practice. We do like to think a minimum of about 80 hours per preceptor to give them the time to properly work with you and evaluate you. And again, those are things that our team will help you arrange. There's a minimum of 800 total clinical hours required for the program. And these 800 hours are dispersed over 4 clinical courses. And Debbie or Jennifer will be talking about how those work within the program. We say a minimum because at times you may want opportunities to do more than those 800 hours, or you may need to have a little bit more than the 800. You need to have an active practicing RN license without restrictions or conditions in the province where you will be doing your clinical placement as a nurse practitioner student. This can impact some people who may live in one province but cross a border. Some people like between Quebec and Ontario, New Brunswick, Nova Scotia, those type of opportunities, you need to make sure you are licensed in the province where your clinical is taking place. We prefer nurse practitioners to be your preceptors simply because that's within our scope. That's what we're making you, we're supporting you to become nurse practitioners. If a nurse practitioner is not available, physicians can be used as your preceptor. And it's sometimes good to get exposure to physician practice, but we encourage you to work mostly with nurse practitioners to be able to learn the true scope. And practicum expectations in the broad view of things remain consistent across both curriculum structures. So both require 800 hours. They're just divided up a little bit differently. And the process for arranging and maintaining your clinical practice is the same whether we're using the current structure or then the program structure, the revised program structure that's coming up. Thanks, Jennifer.
Thank you, Lynn. I'm going to turn it over to Debbie Fraser now, who's the curriculum lead for the NP program and an associate professor. Debbie?
Thanks, Jennifer. Hi, everyone. Thanks for coming tonight. So just to kind of walk you through the new program, it will be the same 33 credits in total. So that's important when you think about how many credits you'll need to take in the program and whether or not a new program versus the old program will result in a different fee structure. Remembering that you pay per credit, you'll pay the same amount whether you're in the new program or the old program. We have redesigned the structure to make the progression through the program a little bit more seamless, we hope. So we've organized it into a 4-block curriculum. So most of you who are thinking about switching into the new program will be students that are in the first block of the courses. And I'm going to talk in a minute or show you those courses. So integrating theory and clinical learning, much like we do now, but with a little bit more structure in terms of progressing through the program. And also you'll see that we've inserted the new competencies throughout the curriculum, starting in the first block. So we begin with Nurse 000, which is the orientation course that all of you will have taken. It also includes the current Indigenous course that's being offered through PowerEd. And so this will be incorporated into the program. It's a 0-credit course, and you will take it in the first part of the program. So as we talk later on about switching to the new program, if you haven't taken the Indigenous health course, that's something that we'll be asking you to take. It's about a 10-hour course. Some of you are currently using that as some of your alternative hours in the clinical. So you may be familiar with the course if you're farther along in the program. So Block 1, 000, Indigenous Health, the current 516 and 517, minimal changes to those courses, but we will be incorporating some of the concepts from 531 because it will no longer be offered in the new program. So that's the Controlled Drugs and Substances course. Progress through, after you've done 16 and 17, you progress to 518, which is our health assessment course. Will stay quite similar to what it is now, although we are looking at some changes in the future to that course. We currently have Nursing 610 in that core or first block of courses that you take. In the new program, we'll be using a different course, which will be brand new, Nursing 612, which will be both research and quality improvement. And then 614, which is Foundations of Advanced Practice. In the second block will be the 3 adult health courses. So we're changing 526 and 528 into adult health 1 and 2. So it will look a little bit more like 16 and 17 does now, in that instead of dividing it into adult and older adult, we'll be dividing it into various body systems. So you'll take half of the body systems in 532 and the other half in 533. We're introducing units on virtual care. We're introducing content on palliative care. And importantly, we're introducing content on what it means to look after patients in the hospital. So how does admissions work, discharge work, transitions of care, med reconciliation, all of the concepts that you'll need in order to be prepared to do clinical practicums in an acute care setting. Block 2 has 2 clinical practicums, so we have 4 in total in the new program, each with 200 hours instead of 250 hours. And we've done that for a couple of reasons, the primary reason being that many students found it difficult to be able to accumulate 250 hours of practicum within one semester. So we hope that by moving to 200, it's still a lengthy enough practicum that your preceptors will feel that they can get to know you and to progress your learning to more independence over the course of that 200 hours. In other words, we can't have them be too short, or there's not enough time for the preceptors to really get to know you and to help you work towards independence, but not so long that it becomes difficult to fit the hours in. So these will be practicums that are done over 1 term instead of over 2 terms. So 2 of them in block 2. And then if we go to the next slide, in block 3, we have children's health. 534 is the current 522. and it's moving to a 2-credit course. We've taken out some of the material that might be repeated in the adult health course, and it will focus on sexual and reproductive health. There'll be one practicum of 200 hours in block 3. And then block 4 is the consolidation block, and that is 535, which is similar to the current 530, except it will be 2 credits. And 539 will be similar to 678, so the final 200 hours of practicum. The first 3 clinical practicum courses will each have 1 credit attached to them, which I think will be helpful to folks, for example, who are looking at some of the funding models require credits attached to the clinical practicum. So that will allow you to qualify for funding in some provinces.
Thank you, Deb. All right, so now the exciting part, and the part that many in the chat are asking: who is eligible to transfer to the new curriculum? So we will require all new students being admitted in this current intake that will be admitted for September will be automatically in the new curriculum. Students who are currently in block 1, so early in the program, will also be eligible and encouraged to transfer to the new curriculum. So those students who have not yet registered in Nursing 526, so if you are somebody who was planning 526, that's the adult health course, which is the first of our life stage courses. If you are planning that for fall, then you are eligible for transfer to the updated curriculum. You must be early in your program to progress to that or to move into that curriculum, simply because their 526 will turn into our new course, which is Adult Health 1, and then the practicums are a bit different structured. So you must be early in the program to make the transfer. Again, those who are recently or newly admitted for this intake, which we have applications that are being reviewed now, that if you are somebody who's applied, you should be hearing from us within before course registration for fall, which is May 15th. So that will be soon. Also, if you happen to be on deferral right now and are early in your program, you are also eligible for transfer. What does it mean if you are not eligible for transfer, and if you are a current student that may have already, or maybe you're in 526 now or 526 in the spring, you are not eligible for transfer, but that's okay. You are not disadvantaged in any way. The program outcomes remain very similar, and to be honest, very much the same, with the addition of those few competencies that I mentioned in the beginning. You will meet regulatory requirements. You will be eligible, of course, to write the nurse practitioner licensure exam, which you must do to become official NP in the end, and you are not disadvantaged. How do you transfer? If you are eligible, you will receive an email from our administrative staff, our administrative team. That email will come by next week, so monitor your AU student email. If you are not yet a student and are joining this call tonight, you will be admitted. If your admission is successful, you will be admitted to this new program or new curriculum, and there is nothing that you need to do. Those eligible in block 1 still early courses will receive an email from us to your AU student email. Once you get that email, there'll be very clear instructions for you. You will either A, decide you want to transfer to the new curriculum, or B, you will remain in the current curriculum and complete the program as you initially assumed that you would. You will need to notify the graduate administrative team. Of course, that email and contact and all of these instructions will be in that email that you will receive within the next few days by end of next week. We must have this in place by May 1st because you will need to register then for the new courses, which will be offered in fall. So what should you do now? Really, there's not much you need to do now other than closely review the FAQs, the frequently asked questions, the link which I posted in Brightspace. and is available on our website. And then wait for your eligibility email to come to you by the end of next week. Please do not reach out yet to our graduate administrative team. They will wait until those emails are sent to determine who is eligible. Do not change your registration for spring. If you are a student now, please, we cannot authorize any withdrawals from courses. Of course, you're welcome to withdraw if you want, but there is there is an administrative fee that is associated with withdrawals at this point because of the fact that we've already staffed all of the sections, ordered the materials, and everything is planned for spring already. Review the FAQ, as I mentioned, and if you have questions about your program, if you need any discussion about course registration for current curriculum, or any type of planning advice, as always, you would reach out to the graduate advising team. So key course changes, just to reinforce what Debbie has already said. 610, which is our current research course, will be 612, will replace that in the new curriculum structure. If you have already taken nursing 610, that is fine. We will consider that equivalent to 612. You will not be required to repeat or do 612. Nursing 526, adult, and 528, older adult, will transition into our new courses, 532, 533, for those who transfer or who are admitted into the new curriculum structure. Nursing 675, which is our initial clinical practicum, which is 250 hours, will be for those students in the new curriculum, will be nursing 536, which is a 200-hour practicum. Something else to note with our practicum courses, they will be changed to a one-semester format. We currently, in our existing program, 675, 676, 678, those are practicums with more hours, and we have allowed a carryover to the second semester. We will no longer allow that with the new curriculum structure. We will, for those students who do not transfer to the new program, who are too far along in their current program, or who choose not to transfer to the new curriculum, who are early in the program, we will have additional learning supports available for you to cover the competencies that we don't currently cover in the program. We do actually cover diagnostic testing. We just don't cover it to the level of depth that we would like to in the current curriculum structure. We are adding these to the new courses. For the people in the existing curriculum, we will add these topics as a module, which will be self-study and will be optional. So they will be available for you to review and complete. They will not be monitored. It will be self-learning, and you will self-select which of the content areas you want to go deeper into. One last note about the NP licensing exam transition. As I mentioned, all across Canada, all provinces are going to a single national NP license. As soon as this summer, Ontario is offering their exams starting summer, I believe it's July 2026. Please do check whatever province you are in to determine what the licensing exam will look like for you. All of our students remain eligible to write the existing exam, which is the CNPE. The CNLPE is the name of the updated exam that is coming in as the single licensure exam. Lastly, key takeaways. This is curriculum update. It is not a new program. You will still graduate with a Master of Nursing, Nurse Practitioner, or a Post-Masters Diploma, Nurse Practitioner. The current curriculum remains valid and is aligned with regulatory requirements. You are eligible to write the exams. You will not be disadvantaged if you stay, but we are encouraging those who are eligible to transfer into the new and current curriculum. The updated curriculum, covers all competencies, and no additional modules will be required of you. They will be available if you want them, but they will be incorporated into the new curriculum. And again, eligible students will receive very clear instructions and email to your AU student email, of which you should be using for all university-related correspondence and sessions. Okay, common questions. I see there are many questions being posted in the chat, so I'll answer a few of them right now. Will this delay your graduation in any way? No, it will not. In fact, it might improve your time to graduation simply because the credits are structured a little bit differently and it flows along a little bit because we're going by blocks now. There are prerequisites per block usually. You can finish the program in as few as, depending on what you come into the program with, students will finish the program within 2.5 years. And our maximum time is 5 years for program completion from admission to completion. Most of our students now finish in about 3.5 years, recognizing that most of our students are practicing RNs. Many have families and other obligations, and many take courses, not necessarily full-time, although we are starting to see more of a full-time load for many students. Will credits be lost? No, the credit structure is the same. You will not lose any credits. Will it cost more to do the new program? No. Credit structure, as Debbie mentioned, our program charges per credit. So each course, depending on how many credits, is what the fee that you pay for that. The credit structure remains at 33 credits for the MN-NP and 30 credits for the Post-Masters Diploma. Do you need to do anything now? No, as I mentioned, you will wait until you get your email. If you are eligible, you will be notified by your AU student email. All right, if you have questions after tonight, please firstly look at the FAQ. They are very robust and have most everything you need. If you haven't heard from us by the end of next week and you believe you are eligible, and I say that as in end of next Friday, then you please reach out to our graduate administration team. They will be your first point of contact for any eligibility or transfer requests, but I ask that you wait until you receive the email. And if you don't receive an email by the end of next week, then reach out. If you need program advice, always contact the grad advising team. They are your first point of contact and are best equipped to answer any program planning type of questions. But again, if the program plan is related to new curriculum structures, then wait for your email and contact after that. All right, that is all I have for tonight. We are right on time at 30 minutes. And now I'm going to open up either, please go ahead and raise your hand if you'd like to ask a question, or we will then go to the chat, but looks like we have questions. I'm going to stop sharing just so my screen's a bit bigger.
Jennifer, I'm going to jump in because I'm just scanning the chat and there's a couple of questions from people here about preceptors. So for Jill Robson's question, 2 preceptors in a semester is probably ideal. There can be discussions about more, and depending what province you're working in, there are different opportunities for potentially things like a team-based placement. That would be something you'd have to discuss with your clinical placement coordinator when you get closer, but it's something we can discuss. Kieran Deep, you said it's a minimum of 2 clinical settings and a minimum of 2 preceptors over the course of the program. It's not one or the other. We need you to have some variety, but that's the minimum. So 2 different preceptors and 2 different settings.
But I think Sue mentioned that for current students, one setting is okay as well. So in the slides it said we need to have, for example, primary care and acute care. But for current students, is it okay as long as it's a primary care setting, but with 2 preceptors over the course of 800 hours?
You're still encouraged, even though it's the current program, because the new licensure is more general and across all ages and all settings, you should really be trying to find an acute care setting. We do have a process in place for people that are in a remote setting in terms of not being able to necessarily find both acute and primary care. So I would just encourage you to talk with your clinical practicum coordinator to see what the options are for your setting, depending again, of course, on how far you are in the program. If you're going into your second last or last practicum, that's kind of put you in a different place than if you're just starting the clinical practicum process.
So Debbie, the reality in GTA is, and respectfully, the placements are super hard to come by. I'm sure it's same as the case across other provinces as well. I mean, in my case, my initial placement fell off and I've reached out to 60 something clinics. The response I'm getting is either we work with local universities or those we have an agreement with, and they just don't, they're not interested. They just email us. Well, of course, like you can mass emailing them, nobody is response to you, or if you go in person, well, email us. So, I mean, I think I'm sure the faculty is aware about the challenges, but I think we must factor that in as well. I mean, I appreciate that it's encouraged, but we also have to look at the realities and the practicalities of finding placements on your own.
Yeah,
and
that's certainly
yeah,
true.
I appreciate that, Kieran. That's kind of totally separate from the discussion this evening as well, because no matter which structure you're following, that's a challenge. Yes, I will acknowledge that. And I mean, the other questions I'm seeing here, and I'll just summarize them quickly. Things about additional supports for preceptors and all, that bridges either program structure we're looking at and would be something that we need to, I'd encourage you to talk to your clinical placement coordinators about when you get to that stage.
And Lynn, the process for AHS acute placements will, because they use the same practicum request process. Yeah. So it will remain the same. We're actually meeting with the folks from AHS next week to talk about acute care placements and what that might look like for the program.
Great, thank you. All right, let's go to the persons asked with their hands up. And again, this session is mostly focused on transfers to new curriculum, what curriculum looks like. We acknowledge Jared and everybody else who is a current student that preceptorship is a difficult situation, which is why on the slides we said ideally you will be with two different preceptors, two different locations. We want to encourage that because, as Debbie and Lynn both said, the licensure is a all ages, all places, all stages kind of license, and you need to get exposure if you have options. But we will have an upcoming town hall where we will discuss general program type of things in the next few weeks. I'll be announcing that tomorrow, the date for that. So let's bring those clinical discussions to that next session.
Yes, thanks.
Megan, please go ahead.
Hi, yeah, so in terms of 610, you said if we've already taken 610, then that counts towards 612. I'm registered for it in May, but I would like to switch. So will the course that I take in May, 610, still replace 612?
Yes.
Okay. All right.
Yeah.
Thank you.
Yeah, what you'll miss from 612, Megan, will be things like quality improvement. So that will be available to you as a program student as a module that you can do self-learning on, because that is not covered in 610.
Okay, thank you.
Yeah.
All right. Jarrett, do you have additional questions?
For sure. I didn't have any question to start.
Oh, but, I'm sorry. I apologize.
Yeah, that was clear and deep. In regards to the different blocks, are you able, like, I'm probably an eligible person. I just finished my first semester here. Are you able to take your last course in a block and a first course inside the next block to be able to keep on going? Or one of my semesters going to be blocked down to only one course? I'm a quick-paced full-time student.
Yeah, we've laid out some journey pathways, but depending on what you've taken already, you may be kind of sort of caught in between. But if you're first coming into the program, we've laid out options for you to finish in 2.5 years. but we do require that you finish all of those preliminary courses in block 1 before you move to block 2. So there may be a semester when you can only take one course, depending on where you are now.
That blows. Thanks.
Jared, if you're planning 526 for, or sorry, if you were planning 526 for fall, then you would be eligible to transfer into the updated curriculum, and you would usually be able to do a few courses at a time.
Okay, I am eligible to go to 526 here in the fall, and that was the plan, with practicum starting in January. But with this 4 practicums, I was thinking I would be starting that in September instead. But
yeah, you would have needed to have your practicum request form in already, though, if you were going to move a practicum to fall, regardless of which program you're in.
For sure.
Right. I did see the comment about somebody asking about prerequisites to all of the new courses. And that definitely, we have that available already. We are in the midst of updating the calendar website with all of the syllabi. And I will definitely post that within the student news forum as soon as we have it completely finalized in the next few days for your information. Miranda.
Hi, thank you. I am sorry to ask more questions about 610, but I am a non-program student. I just started my application for the program today. So I'm just wondering if they'll still accept that when we do get accepted into the program, if 610 will still be eligible to replace 612.
Yes, that will be what we call precluded course. So it will be considered if you do 610 and then, like yourself, a non-program student applying and you're admitted, we will it will be considered equivalent to 612, our new course. And then we will just suggest to you that you do those additional learning modules on quality improvement.
Thank you.
So you will not be disadvantaged if you are currently registered or planning to register in 610. Ashley.
I'm just wondering, for those who aren't able to switch, who are far in the program, the module courses, will those be free, or then do you have to pay addition to have those optional courses?
Those will be free for all students. They will be posted in a similar fashion as we have the NP student guide and the clinical guide in the Brightspace course. They will be like a PDF sort of bundle of information that is available free for all students. Jessica.
So I'm ineligible to transfer because I'm like farther down in the program and have already taken 526 and 522. So to continue on, do I just register for the previous courses that I would have registered for? Like I'm registered for 528, I think, in the spring, and then I just register for 530 in the fall and I register for 6, 7, 8 in the fall as well for my final practicum. Like I don't have to register for different courses. It's the same course codes.
You're correct. You would do exactly the same as you would now. The prerequisites, everything is as is for those students who are not transferring. Exactly the same.
Okay,
Jennifer,
thank you.
There's quite a few questions about 531. So
yes,
what will move into 516 is some information on legislation. What will move into 517 is a new unit on pain. So we can make those pieces of information available to students who are moving into the new program and won't be taking 531. The rest of the information from 531 is going to be in 527 in the new program. So much of that information you'll still get, even if you've missed what was in 16 and 17, but we'll make that available as a separate module as well.
Thank you. Yes, we didn't have that on our list of learning modules, but definitely that is planned. We anticipate those modules will be available for September when the new curriculum opens.
And if you're staying on in the old program, you'll continue to have 531 available to you, so that all of the current courses that are in the current program will remain available until people are finished that program.
Right, so we will essentially be running sort of alongside each one set of curriculum for existing students who are enrolled now as program students who do not or cannot or are not eligible to transfer. We are obliged to finish you through your program. You have the 5 years to finish the program. So we will be running those existing courses for essentially 5 more years. So nothing changes for you. We would encourage you to, as I said before, look at those additional learning modules that will be available to you for things that you have not or are not covered in the curriculum currently. Please do note, though, although if you look at the blueprint for the new exam, NP licensure exam, you will note that very few questions are devoted to those new competencies, the competencies of communication, counseling, QI, etc. And most of those you could probably answer as an RN, but we will have that additional information available for you, and but you're not disadvantaged. Jessica Edwards, did we answer your questions?
Oh, yeah, sorry. I didn't raise my hand. Sorry.
No problem. Other Jessica Camus.
Hi, thanks for all the helpful information. My question relates to clinical practice hours and whether they're different in the two programs in regards to hours spent seeing a patient versus hours spent during time in clinical. And then the second part of my question was, the Indigenous course doesn't count towards alternative hours now, is that correct?
If you're taking the Indigenous course as part of the curriculum, then you won't count it towards alternative hours.
Okay.
And Lynn, can you speak, Lynn, to the patient hours versus
Yes.
clinic hours?
Right. At this point, those of you who are doing clinical courses, you know that you enter and type your logs according to the time you spend with your individual patients, and that's how you get your total hours. Beginning in the fall, we're going to shift away from using patient time, and we're going to move to shift time as a way to reflect your hours, acknowledging that there's things you're doing with your preceptor and good learning opportunities that may not be forward facing to a patient. And for that reason, alternative hours beginning in the fall will no longer be part of the math when you enter your hours. So if you're in your clinic site for an 8-hour day, you put in 8 hours if you do that work for 8 hours. There will be instructions and updated videos from Janice Young. You'll still be expected to log patient encounters as you do now, but the time you spend will be counted as the shift.
Okay, thank you.
Linda.
Is that across both programs?
Yes.
Okay, thanks.
Yeah.
Yes, and we definitely will plan. We have upcoming sessions that we will fully introduce this to you, provide you documentation, full instructions for those upcoming clinical practicum changes.
Yeah.
And as Lynn said, those will not come in effect until fall. And we have a long runway to introduce that to you. But it's good to introduce them now, and those changes I think will be welcomed by all students. So
and
and
just to reinforce the importance of watching Janice's videos, because Janice makes incredibly detailed videos, little short snippets. That's where you need to refer. And, she'll help you with the typhon issues, and the rest of the instruction about the changes will come through the clinical course side of things.
Thank you, Lynn.
Kieran Deep has a question, I think.
Hi, so this question is more so for Dr. Miller. In regards to when we say we need to the preceptors need to have a minimum 1 year clinical experience. So when do you start calculating that 1 year experience? Because in Ontario recently, CPSO, they introduced a provisional registration starting January 1st for all the physicians who have had restrictor certificate. Previously, they would have a restrictor certificate for, I think, 5 years. But going forward, that restrictor certificate automatically gets bundled into what they call a provisional registration. So when do you start calculating the 1 year experience? Is it from the original date when the first registration certificate was issued, or from the date, which is January 1st, 2026, a provisional certificate is issued? And let me share my screen because I've been scratching my head at that and like just having some issues with that.
So,
because most
so Kirandeep, if I can interrupt here, this is beyond what the scope for this evening is. This is a question for your clinical placement coordinator directly. Okay.
All right. Thank you.
Thank you.
But definitely, that's interesting that you mentioned that, Kirandeep, because I know Dr. Miller just attended the National NP conference where they talked about exactly this and presented this, and
Yeah.
we have many things to consider, and that will be direct that to your clinical placement coordinator,
please.
and
Yeah.
also we will cover that in our clinical session that we plan to host soon.
Yeah, we're still researching implications across the country as well, Kirandeep. So yeah.
Amy.
Sorry, I missed how, if we're in Alberta here with AHS, how do we pursue doing an acute placement? How do we confirm that ahead of time? I don't want to be like without something last second.
So please reach out to Sherry Jansen, who's the clinical placement coordinator, or you can reach out to me. Those type of specific questions are best answered by Sherry or whoever your placement coordinator is for your part of Canada.
Thank you.
Another good first point of before actually reaching out to anybody, please do check the student guides. We have a very robust student NP student guide for the program, and we also have a guide for clinical. And in that clinical practicum guide, there's really specific instructions for looking at a private practice, or what you would consider sort of a family practice, physician's office, so private, versus requesting a placement through a regional health authority. And there are different processes. So please review that, especially for Alberta, there's good information in there, and then reach out to the preceptor coordinator.
Sorry, I had reviewed it. It's just now with the change of encouraging people to do acute placement, like, are you not changing that then? Like,
process
no.
is still the same.
Process is the same. Okay,
Yeah.
okay,
Yeah.
That's where I was confused. Thank you.
Yeah, no problem.
Fair enough. The process for most regional health authorities is through that centralized placement, where we have, I would say, fairly limited control over those placements. It has to be centralized, and Alberta has one of the strictest sort of rules around that. Jarrett.
I apologize, I'm needy with multiple questions. I'm one of the rural remote students. My practicums that I haven't started, but are setting up, will be with rural docs who work both family practice and acute care. With those pieces that would be fine to cover that acute care piece, even though they may be 1 week of the month at the hospital and the rest in their clinic. Perfect, thank you so much.
Ideal, actually, in most cases.
Yep.
Yeah.
I'm going to intersperse a question here from the chat. Can I take the new adult 1 course with clinicals? Yes, you can. Whether it's advisable or not really depends on your personal situation, whether you're working full-time, looking after kids or aging parents, et cetera, et cetera. Keep in mind that the clinicals in the new program are shorter, only 200 hours instead of 250. So that may help you be able to take them both at the same time, but you'll need to talk with your clinical practicum advisor about your own situation in terms of, you know, what your workload is and whether you're able to manage a clinical and a theory course at the same time.
Yeah. And to Deb's point, I mean, for those folks who have done clinical already within the program, you know that we've accommodated the 250 or 300 hour clinical courses that you can do it over 2 semesters if you need. That option's not going to be available under the new structure. So you have to do those 200 hours in one semester. So I would, to Deb's point, I would seriously encourage you to think about your work-life balance and other obligations, and don't overextend yourself, I guess is the best way I can say it.
Ashley?
I just wanted to confirm the good old Indigenous course that we always talk about. I'm in the old program, and so you're going to be taking alternative hours away come fall. It totally makes sense with like changing to clinical hours. I'm just wondering, I was planning to take it in between semesters right now to apply it to 6, 7, 6, yeah, in spring. Will that still be counted as alternative hours because it's still spring, or should I just not worry about taking it? If that makes sense.
I think it's good content to take. I've done that course and it's an excellent course to take. And, you know, until fall, so for spring semester, you would still be eligible actually to count that toward alternative hours. So if you chose to, and I would encourage you, it's a good course.
Okay. Okay. And it can be done between semesters. Like that is okay. I know we've asked that several times, but there's been so much, like back and forth between students. I just want to clarify.
That's okay with me. Just make sure you look at the instructions on how to log that properly in Typhon.
So Brittany's asking about the 2 different programs and specifying what we're calling them. And so we're using the terminology current program and updated program. And in some of the regulations you may see for students admitted prior to September 2026 and those admitted after September 2026. So those would be the 2 ways that we would differentiate between the current program and the updated program. The module courses will be available in the fall, and they'll likely be in NP student resources. We'll confirm that, but that's our current plan, is to house them there. And yes, Allison, as Lynn said, applying the patient hours versus shift hours will apply to both programs. Where are Janice's?
Sorry, Deb.
Then where are Janice's videos posted?
And the NP student resources.
Okay.
There's a question about the workload for adult 1 and adult 2, and is it going to be dispersed a little different than 526 and 528?
I think it'll be more even. We've really tried to have appropriate number of hours or weeks for the content, and balance between the heavier modules and the lighter modules between the 2 courses. So I think you'll find them a little bit more balanced than the current 526 and 528 split. And that's one of the reasons that we wanted to start fresh with those 2 courses.
Brittany, I just want to answer your question. Brittany's our student rep. So hi, Brittany, welcome tonight. Brittany's asking if there are 2 different programs. If we ever to email faculty staff, should we now specify which program we are in? And if so, what is the term that will be used for each program? That's a good question. Faculty and, well, not as much faculty, but staff will definitely know which set of curriculum you are in because of the catalog date that you have attached to your program. So on the back end, that information is in the FAQ. On how to access that. That is through, maybe if one of our advisors is still on the call, Janice or Tanya, if you have more of an answer to that, will you be able to quickly know by looking at the catalog date?
It's Janice here. Hi, everyone. If a student goes into DegreeWorks and they've formally changed to the new curriculum, or they're staying in the old curriculum, DegreeWorks will reflect that. So that's an easy visual for you to know. So when you contact the advisors, you don't need to say if you're in the old curriculum or the new curriculum. You just need to tell us you're in the NP program. We'll be able to figure it out by the courses you take.
Thank you, Janice. Of course, you must include your student ID and be emailing from your student AU account. I can't say that often enough. Remember, we have a very large NP program spread across the country and across time zones. And the only way we can look you up efficiently is by you including your student number. So please always remember a plug for that.
Yeah. And the
Deanna,
other thing, sorry, Jennifer. No, the other thing I want to remind folks too on that note, using a Hotmail or a Gmail or a one of those outside emails sometimes gets steered into our spam folder, so we may miss messages. So the only way to know that we're getting is please, please, please use your AU email and include your student numbers on all the correspondence.
I think Deanna had a question.
Yes.
I'm not sure if this is the meeting to ask it, but I know that when applying for different practicums, it's usually 6 months in advance. With the new the new curriculum, is the timeline of when we find out if our practicum is approved going to change? Because I know right now practicum approval can happen like a week before, and then what happens if we don't get it and are enrolled, and the blocks and all that type of stuff, like then we're kind of stunted and down a semester, right?
Yeah, it's a good question. Some of the approvals, Dan, we don't hear back, especially if it's an HSP net, one of the what we call centralized. Sometimes you don't hear because we don't hear. There's times that we may not hear till a week or 10 days before the semester is due to start. If that should be the case, or if something happens that it falls through, the clinical placement coordinators in your region, we will do our best to help pivot and find you something as quickly as we can. And we will have to, be mindful of maybe having options planned ahead of time, to have a plan B in place, just in case something happens that first one falls through. So it's something that your clinical placement coordinator will work with you for.
Thank you.
Wendy's asking if you still need to take both the life stage course and a practicum simultaneously. And no, you don't necessarily need to take them simultaneously. You just need to be aware of the prerequisites and making sure that you're interspersing your clinical courses with your theory courses, but they don't have to be taken at the same time. And then the question is, are we allowed to enroll in 527 and 531 during the same semester? And in the old program, yes, you can. In the new program, you won't be taking 531 for those that are changing to the new program.
All right. Well, we are close to the bottom of the hour. And we will definitely, I hear all of the clinical questions are top of mind, and we will, the next semester starts January, May 5th, I believe. And I will announce the student town hall, which will be the week after that. I believe I have it scheduled. Well, I won't even say because it's the week after. I will post that tomorrow morning. And we will be scheduled a little bit longer for that meeting, knowing that there are many questions, and probably these questions and all of this new information will simmer, and you probably will have many questions. So I will close the meeting now, and thank you everybody for joining us tonight. And watch for, if you're eligible, watch for your email. It will be coming to you within the next short while. And thanks again for joining us. Oh, it looks like we have one last question. Nikki.
One last question.
Hi, thanks so much. I was just wondering, I know previously we had to take adult health as our first life stage course. If we're transitioning from the old program to the new program, I feel like for me, this 4 practicum would extend how long the rest of the course would take for me. Can we do any other life stage courses before we do adult health?
So in block 2 is adult health 1, adult health 2, and 527. So you can take adult health 1 and 527. You can take adult health 1 and the first practicum. You could take adult health 1 and 2 together. But the most, I think, pedagogically appropriate way to do it would be adult health 1 plus 536, and then adult health 2 plus 537. So the theory course with a practicum. And then you could double up and take 527 in either of those semesters, but that's the way I would recommend structuring the second block. And then you move into the third block where you take 524 4 and the old 522, which will be 534, plus that third practicum. So they can be doubled up together depending on how much time you have.
Would that be a very heavy semester to do the two adult healths together?
It would be like doing 16 and 17 together in some ways. So it wouldn't be what I would recommend, but if, depending on if you've taken a leave from work, and you don't have other responsibilities, it's certainly doable. There's nothing in one course that precludes you taking them together. But I think a much better way to do it would be to take 532 and the first practicum, plus or minus 527, and then take 533 and the second practicum. So that would allow you to integrate the theory and the clinical together. So that would be the most beneficial way from a learning perspective to do it.
Okay, thank you so much.
All right, thank you, everybody. Let's close the meeting for tonight, and I will post all of this information for you in the NP student resources in the next few days. Thank you and good night.
Thanks, everyone.
Thanks, everyone.
Good night.